See, it's really interesting though, because it's almost paradoxical to the whole motto of don't die. Because this is your number one primary goal above all else is stay alive. But then yet you will justify the risk to reward as a clear positive on like very exotic, unproven chemicals sometimes. And I'm not to judge. Like I've certainly taken my fair share of random stuff that's not made it even through phase 2 trials. Not as much nowadays, but when I was younger, that was something, I'd be willing to take cardarine, which is like a super enhancer of endurance, but caused cancer at every dose in rodent studies and got canceled. And that's the kind of stuff I was willing to take back then, but now I'd say, hell no. So I'm just like trying to make sense of the logic or the risk aversion or lack thereof. Like I suppose the novelty factor and how fun it is can supersede the don't die. And you think the risk to reward, the risk isn't as high as perhaps, other people might perceive it to be, I suppose.
Yeah, I don't think we've never done anything that compromises safety.
Like some of the drugs, like oral minoxidil.
Tell me, what do you think is the risk profile of that? And why would you be?
I don't think it's super high, but when it's in accordance with all the other things, you already have a resting heart rate that is so low and presumably a pretty low blood pressure too. And it's used as a primitive hypertensive anti-agent. And there's just so many cases of arrhythmias, edema, like all these things that for the upside of potential, I don't know, like some cosmetic difference in hair count that maybe is slightly better at the microdose than you would have risk-free short of the actual surgical procedure, but isn't an extra drug. Like to me, I'm thinking, if I'm Brian, I'm doing transplant over a neck warning drug.